So this is a fantastic exercise for people with osteoarthritis in their knees. So the knees are particularly compacted, the joint surfaces don't have much cartilage left, the knee is pretty big and swollen. And what we're trying to do is just try and create a bit of space for the joint, and try and get a little bit of lubricating synovial fluid back into the joint. And the best way to do that is if you can find a high surface where the leg is dangling. And what we actually want to do is to try and relax the lower leg as much as possible. And we're just going to start off by just doing some gentle swinging of the knee. So you can just nice and floppy, almost letting the leg move itself. So you're moving it within a kind of a pain-free range of movement. So you just let that kind of just moving forwards and backwards, you know, try and get a little bit of movement there. You might try to sort of bend it up a little bit lower, okay? Or you might want to sort of straighten it out a little bit more as well, okay? Now the key bit normally for most people is the inside of the knee that's the worst, but if you know that the outside of the knee is more of a problem, then you can just reverse it. But for the right knee, what we want to do is you want to try and open up the inside of the knee a little bit, okay? And the best way to do that is just to try and do a little bit of circling in a clockwise direction. So literally just doing a little bit of that, okay? So you warm up with a bit of forward and backwards, and then you just do a little bit of gentle sort of movement into circles. You can even just do a little bit of movement out to that right side, so just letting the knee hang and dangle, okay? Now I would recommend just doing this initially just with the weight of your knee, and the weight of your lower leg. But what you can do is you can use leg weights, so you can get little ankle weights from places like Decathlon where you can just put them around your ankle, and it just promotes a little bit more traction in the knee, okay? And literally just do this for 5 minutes every morning when you get up and the knee's pretty stiff and sore. Just a bit of forwards and backwards, a little bit of round in circles, but try and do clockwise if you have a problem with the inside of your knee, and you could try anti-clockwise if you have a problem with the outside of your knee, okay? But generally speaking, clockwise usually works best in my experience, okay? So just do a little bit of that. It just tends to get the knee moving, gets a bit of lubrication into the joint, and quite often people feel relief from that for osteoarthritis. Okay, I hope that helps.